Well, thanks for joining us today here at the Culturati Summit. And I think what's really fascinating about this summit is that it's about thinking about the next horizon in workplace culture especially, and the challenges that executives face in 21st century firms. And given our particular moment in this sort of post-throes of COVID moment, even as we're still dealing with the pandemic, I think there are a lot of workplace and mental health issues that that companies of all stripes are dealing with. I wanted to ask each of you what you see as currently the chief challenges to a healthy workplace in the year 2023. And also, what ways do you think we're working to solve those that you think are most promising? David, would you like to start?
Yeah, so the context for me, and it's really wonderful to be here and share this question with others. For me, I work in an academic medical center, and this is an academic hospital with extremely complex patients. This involves learners of various types, undergraduate students, medical students, residents in training who are training to be the leaders of the future in delivery of care. And what is really, really interesting and relevant to this conference is that this is an extremely high-stress environment. There are very ill patients coming to the emergency room who need immediate care. There are physicians in residence who are licensed physicians but training to be neurologists. I'm a physician neurologist. They're training to be neurologists, and they're in overnight seeing these patients with an emergency room doc, but they're not fully trained, and they're connected to us. And what's very interesting is the high level of stress, which traditionally has been responsible for burnout and physician dysfunction, mental health problems among physicians, and which compromises the care of our whole population. It affects everyone. So this is the challenge that was amplified in the COVID period, and we are trying an experiment. And the experiment is really fascinating, and that is to turn everything upside down, which is rather than a top-down approach where you have the most experienced neurologist, the chief of the department, the chief of the service, sort of dictate and kind of an autocratic system. We turn it completely the other way around, where there's agency among the learners to bring the most interesting, complicated, challenging cases they've seen overnight to morning report. Mm-hmm. Morning report is just 30 minutes in the morning, and our faculty come to it, and historically morning report was top down. The chief of the service would listen to the case and proclaim what was going on, and it was very, downward and
traditional.
And it was a fearsome event. Uh-huh. It's extremely stressful for the learner because they want to make sure they got everything right, and they don't want to be embarrassed. There's shame, humiliation, all the things contributing to burnout. We're turning it the other way around. We are having the learner bring whatever case they want to this group of experts to be helping them figure out what to do next. And what has emerged from this after tweaking the model, it's an experiment, we're studying it, and we've been doing it for a year. We've learned that, first of all, they enjoy it very much. They can't wait to sign in, and we've encouraged the faculty to debate among themselves so they can watch us argue with each other. Like, yeah, I trained on the East Coast at elite institution number 1, and this is how we did it. Well, why did you do it that way? Institution number 2 in San Francisco does it this way. Oh, well, let's talk about that. What's the evidence? And the learners just love it, and they can't wait to go. And they're sleep deprived, overworked, and they love it. They don't miss morning report because there's a certain element of playfulness and gaming, and it's meant to be light. Right. But intense, and it's centered around the patient. The patient is the teacher. The patient is teaching us what to do best next for them. And now the focus has changed, and burnout it sets the tone for the rest of the day.
That's interesting because as somebody who's not a doctor who didn't go to medical school, there is the impression that medical school favors almost a macho-ness. And
I'm getting
that seems
PTSD
like
just from him talking about
right,
morning
exactly.
report.
It seems like
Yeah.
to pull away from that. Well, and George, this should not be a traumatic event for you today. Are there things that come to mind, spring to
Well,
mind
you know,
for you about this?
I think the coolest part of this whole process, and there are lots of terms that are thrown around, is the kind of honest reassessing of where we are as leaders, the sort of mindfulness of it. And people are looking at stress and stress responses from a leadership perspective. This is an innovative, creative approach to what is typically a very stress-provoking setting in terms of morning report. And I think that's really important. How do you develop a style of conscious leadership that gets people out of a defensive position where they're feeling disempowered and exhausted and wasted energy and not important, to one where there's engagement with other people? When I look at the talk this morning, there was a lot of discussion about involving other workers in this process of creative solutions. And I think when that happens, there is a lot of flow in a company. There's a connection of the workers with what you're doing. And I've seen that in my own work when I was president of the medical society, we had an unusual number of physician suicides the year before that I came into office, and we had to respond to that. And we realized that it was not sufficient to just hammer on the insurance companies or the hospitals to provide some little perk. We really needed to look at how we as physicians were approaching our stressful lives and how we were going to manage that. So most of our effort was directed at the physicians and providing a skill set for them and rethinking how they manage stress.
Saying heal thyself isn't good enough.
Not good enough. It's not good enough.
So I want to. I realize something. This might be. Did I actually ask you guys to introduce yourselves for the sake of the video that people are watching? Why don't we take a minute for each of you to do that? David, would you like to introduce yourself?
Yeah, I'm David Paydarfar. I'm a physician and neurologist. I came to Austin from Massachusetts to start a new neurology department at Dell Medical School at University of Texas, Austin, and I'm the founding inaugural chair of the department and the inaugural director of the Mulva Clinic for Neurosciences, which is an institute model for care, research, training, all aspects that go into our field of neurosciences. It includes psychiatry, neurology, and neurosurgery. Just saying that sounds stressful, doesn't it? So
I wasn't going to say anything.
Yeah, but the point which George made, which I think is really amazing, is that we think that agency of the trainees and the young faculty and those who are growing in the system, it's a learning system, and creating checks and balances, creating transparency, that's the very fabric of democracy. And so, we're bringing that into the firm where, the emperor really doesn't have any clothes. We have different viewpoints. We've got learners who are asking great questions. Let's bring it out. Mm-hmm. And that gives them agency, and it's the antidote to burnout in our view. It's a hypothesis that we're testing with this model.
And George, would you like to?
Sure. So I'm George Santos. I'm a psychiatrist in Houston, and so my career path has been different. I'm in private practice and have been almost since the beginning, but a big chunk of my work life is in the public sector, almost on a volunteer basis. So I've set up a number of hospitals, and that's been an interesting exercise for me in starting how do you create a new hospital space and a working environment. Then at the same time, I've been involved because I also do a lot of organizational leadership within organized medicine. How do we respond to large community systems issues through legislative advocacy? Lots of time spent here in Austin, crying for more money for mental health services, those kinds of things. And then we've had the unusual circumstance in Houston of a couple of major natural disasters. So it was an interesting exercise in crossing all the borders to set up our emergency response for the Katrina evacuation. And then some years later for the hurricane flood of Harvey in Houston, where we had to operate massive disaster clinics in 2 different sites with thousands and thousands of people, and operating primary care and emergency psychiatric clinics 24/7 for, with about 4 hours notice. So that was a really interesting experience. And it teaches a lot about that. I used to tell my staff at the hospital, I know it's really tough, you've got lives, you've got hospital work, but you need to go pull a shift over there just for the experience of what's happening and how do you respond to that kind of a stress.
Let's one last question here. Are there some practical suggestions that you have for people who might be watching this video about whether the forum is a medical school, a hospital, or their place of work, about how to encourage workers to look after themselves, and what people in executive positions can do to help them?
The idea that we're testing, we're studying it, we're implementing it and studying it, is that we talk a lot about working hard and playing hard, and that's the antidote to burnout. Is you work really hard, you're exhausted, and then you play hard. We're toying with the idea that you bring playfulness into the workspace, which is tricky because if people are joking or there's humor that's inappropriate, it can offend others. It requires a kind of a cultural ambience that defines the nature of play in that work environment. And we're really setting, and this is the very essence of culture. And so that's the experiment we're doing. We're seeing whether it might actually lead to increased productivity and really creative minds. How do we foster curiosity? How do we foster initiative? How do we make it so that people who are young and being paid a lot less because they're just starting, how do we get them to really put energy into the system? And I think this playfulness has a long history in neurology, the study of playfulness in the brain. I mean, every young mammal plays intensely. Well, you'd say, well, that's kind of putting them at risk of getting hit by predators, but playfulness is a trophic effect. It helps the brain grow. It helps the brain differentiate. It helps the brain. And we also know that grandparents will live longer and healthier if they have a sense of purpose with their grandkids, with their family, with the community. This playfulness and engagement that is enjoyable, hard work with enjoyment. What is that secret? I think that is the secret sauce, and that's what we're playing around with and studying. But it does relate to long-standing, probably in the 70s, the famous experiments that were done in young mice who were given a very playful environment, other mice that were given a somewhat rigid directives, and the young mice that were in a playful environment had much more, by quantitative measures, more sophisticated brain circuitry. And so that will increase productivity. That's the idea behind it.
Right. Well, I feel like anybody who has, observed dogs, for example, who are puppies growing up, who are trying to make these distinctions, or have read, Jack London and how these dogs learn to be productive workers as well as, playful in their own way, can relate to what you're saying.
I totally agree. I think what's interesting about this, and we had these interesting discussions at the CEO dinners, it's awareness. It's about being willing to be aware and looking at how you operate an entity, whether it's a hospital or a department or a business. You have to think about the process that unfolds as you interact with workers. So there are these very simple processes that people tended to react to yesterday during the play around capitalism. People were uncomfortable with the starkness of it and found themselves getting defensive. And burnout tends to be when you see yourself in this fight for survival, you're on your own, you don't have any external resources that are plugging in, And as you get more successful in looking at how do you respond to that, when you engage others like in play or in other kinds of collaborative efforts in a work setting, and then move towards a more creative response, you have a different outcome. You have a different level of engagement of workers and leaders, and people have this flow that's really positive for the company in whatever format that company is. And I think part of that is being willing to be honest and self-aware. Look at this process that's unfolding in your interactions as a leader in running whatever entity, and not just being an automatic in those responses, not being, you have to be able to have a moment of pause and step back and say, is this really working? And if not, what are some novel solutions? How to engage other people to be able to help in creating that new space? And I think that can be very successful.
Well, thanks to both of you for participating in this discussion this morning.
Thanks a lot. It'll be fun.
Yeah.
Thank you.